So you have your own machine that makes the crowns right there.
That's right, the CREC, yes. Typically the way that crowns and inlays and onlays, these are all restorations that used to be done with the lab. What you would do is the patient comes in, you work on the teeth, you put some of the goop in their mouth, get the impression of the tooth, that's sent out to the lab. Patient goes home with a temporary, sometimes stays on, sometimes comes off multiple times.
Okay.
Then they'll come back at a second appointment where we take the temporary off, have to numb them typically a second time, and they get this restoration that hopefully fits, and if everything is if everything is done, that's the end of it. Now with the CREC, you're able to.
That's the name of the machine that you use that makes crowns.
It's basically a 3D printer that uses porcelain, and it shaves this block of porcelain and gives you a tooth right then and there. So on that same appointment that you came in for the preparation, we have this, it's a camera, it's like a wand. We basically take a digital photograph
of the
tooth.
goop.
No more impressions.
Oh,
yeah.
Nice.
Take the picture, it goes into the computer, you design the restoration for the patient. Takes about 10 minutes for it to grind out that piece of porcelain. Right then and there, you cement it, and they're done. No more temporaries, no more impressions, no more second appointments.
So it's like teeth in that same day.
Exactly, and that's the for people that are busier and they don't have time to keep coming back and forth. And I have some patients that are notorious for losing their temporaries midway through. This is a very nice way to go.